Welcome, everybody. If you're getting older, and who isn't, or you have parents who are aging, the Oldish is the place to be. This is where we chat about everything related to aging, the challenges, the highlights, all the good, the bad, and the ugly. My name is Karen Brown. I'm the publisher and the editor of the Oldish, and I'm so glad that you've joined us. Welcome to our new viewers. Welcome back to those who have been with us before. This is episode 51, so we've been doing this for nearly a year. I would be very grateful if you would share this with your friends, like us on Facebook, follow us on our other social media accounts like Instagram. We are at the Oldish there. And today we're going to talk about 10 studies related to aging. Now, yesterday we published an article related to a science called geroscience, and that's sort of the umbrella scientific look at aging from a molecular and cellular level. We're going to look at 10 specific studies for you to keep your eye on today. The first one is cell regeneration in the area of hearing loss. Now, the first phase trials have already happened and the results are going to be presented in early 2019. This is really important because we know that untreated hearing loss leads to social isolation, depression, a greater chance of developing dementia, and that your cognitive abilities decline faster if you're not connected to and engaged with the world around you. So keep your eyes on that one. Number 2, cognitive rehabilitation therapy has been developed in England. This is quite interesting. It deals with dementia patients, and it is a therapy that teaches relearning of skills to these patients. Things like preparing a meal, managing a calendar. It's really increasing self-esteem and a sense of independence, and it takes a bit of the weight off the caregiver as well. So there's a therapy you can look into and see if it's coming to your area or if the facilities and community centers in your area might not be interested in looking into what they're doing in England and bringing something similar to where you are. Number 3, alopecia. Now, that's not just balding, it is actual hair loss to a greater or lesser extent on every area of the body. It affects men and women equally. It's tied to the immune system. So the drugs that they are testing suppress the immune system. The proviso about this is that you've got to be careful about other things that you do, because when your immune system is depressed, it opens up a lot of other potentials. So you've got to be careful about this, but this is the first new development in treating alopecia that has come along in a very long time. Alopecia, of course, does lead to loss of self-esteem, loss of confidence, social isolation, depression. None of those things are desirable in an aging population. None of those things are desirable in any age group, of course, but in an aging population, things like depression are more difficult to recover from. So keep your eye on that drug. Another new drug called Levodopa is our number 4. Now, Levodopa was approved just hours before the US government shutdown began. As of this recording, we are still in the midst of it. This new drug targets Parkinson's disease. And again, it is a drug that is the first in a very long time to successfully deal with the effects of Parkinson's. Now, the drugs that are normally used in Parkinson's aren't steady all the time. They have what are called off periods. What Levodopa does is it comes in and equalizes these off periods for motor and non-motor skills. So that is a good thing to have, and we will watch that with great interest. Number 5, stem cell injections. They're becoming more widely available to treat joint damage and pain. So the cells are taken from your bone marrow or fat, or they can come from a donor, and then they're injected into your joint, ligament, or tendon. This is probably something you have heard of for quite a while, but the fact that it's becoming more widely available and kept an eye on as it goes forward is a really good development. Number 6, caregiving PTSD is being studied at the University of California. Yes, it is a thing. PTSD is absolutely a thing that applies to caregivers. And they are looking specifically at caregivers who make decisions following hospitalization of a loved one, or they are caregiving for somebody who has a chronic condition. This can lead to anxiety and depression within the population of caregivers. And caregivers are, of course, encouraged to start their caregiving with a plan, but it doesn't always work out that way. Sometimes what seems like a little thing here or there can very quickly transition into full-time caregiving, and PTSD can be a result of this. So we're going to keep an eye on that study. The British Medical Journal published research that we're going to highlight as our number 7. That indicates that the peak risk for heart attack is 10 p.m. on Christmas Eve. It goes up by 37%. Your chance of having a heart attack on Christmas Eve increases by 37%. Christmas Day, the risk increases by 15%. So Christmas just happened, but as you prepare future family gatherings, you might like to keep these statistics in mind and plan to keep things calm. All those family gatherings are apparently far more stressful than we realize. Number 8, research into fall strategies was published in the Journal of Biomechanics recently, and they were specifically looking at a strategy called tuck and roll, which was taught to older adults who are fallers, and it is intended to reduce the fall impact severity. Now that's really important because injuries in older adults can, in a heartbeat, result in complete loss of independence or enough loss so that you can't live independently anymore. You may have to move into a long-term care facility. You may have to have caregivers living in your home to help you with the tasks of daily living. So anything you can do to avoid injuries related to falls is a good thing. So what they found was that participants lowered the hip impact force by 33% when they used this tuck and roll strategy. Now that's huge because 95% of hip fractures occurred when people fell to the side. This was not part of the research, but I'm going to tell you, you should wear hip protectors. 95% on the side, hip protectors could really help with that. But a tuck and roll strategy is something that research has determined is really very effective. Number 9, several studies were done on the effects of regular exercise. We published stories on a lot of them. Aerobic exercise in particular was shown to improve cognitive function. That's pretty good. Moderate aerobic exercise such as brisk walking or cycling combined with resistance training for 45 to 60 minutes showed the most benefit. That sounds great. Now we've talked about exercise here a lot, and the typical recommendation is 150 minutes per week. So that can be 30 minutes a day if you just do 5 days a week. But this study is showing 45 to 60 minutes showed the most benefit. So there are some of us out there, myself included, who might want to ramp up the time just a little bit. Yale Medical School has our number 10 spot. Researchers have developed an algorithm that can be applied to a standard blood test to help patients identify changes in lifestyle that can improve their biological age. So your chronicle age is how many years you've been on this earth. You're 40 years old, you're 60 years old, you're 70 years old. Biological age is the age that your body functions at. So we all want to function biologically at an age that is less than our chronological age at this point in our lives, for sure. So changes like exercise, eating a healthy diet, not smoking, and being socially engaged can improve the well-being enough to decrease your biological age. And in turn, your chronological age lengthens. Isn't that neat? I would like to do that, for sure. So all of this is enough to make me wish that I was born later. I'll bet you wish you were born later too. Science, of course, has figured out how to keep us living longer. Now they're trying to figure out how to keep us living healthier as we age. That is it. That's all for today. Thank you so much for joining us. Please join us again next Wednesday at 12 noon Eastern Time. And until then, please follow us and like us on Facebook. Follow us as well on Instagram, where you can follow us there. Hit that follow button. And we will see you on the various social media platforms. Until we meet again, please do remember that it takes a village to age a senior.